Welcome to this journey into the profound wisdom of classical Chinese medicine. Settle in, relax, and prepare to explore the inner landscape of your own being. Western medicine often focuses intently on the disease itself, the anomaly, the pathology. But classical Chinese medicine, derived from ancient texts like the Huangdi Neijing, focuses first and foremost on the person. Consider this gentle inquiry. Have you truly come to know your body's innate wisdom, your deepest, most fundamental truth, your inner blueprint? Beyond symptom management. The ancients understood that true health management begins not when sickness arrives, but long before. In the timeless wisdom preserved in the texts, we find the core philosophy of treating the disease before it manifests, Zhi Wei Bing. This concept asks us to observe subtle imbalances and tendencies before they solidify into physical ailments. The foundational texts detail how in the earliest times, treating disease simply involved the concept of transferring the essence and transforming the qi, yi jing bian qi, as external evils could not penetrate deeply into the peaceful hearts and bodies of the people. Today, while life's complexities mean external and internal disharmonies, such as emotional distress and deviation from seasonal norms, can indeed cause deep illness, the principle remains. Prevention is the highest form of mastery. TCM principle, the holistic blueprint. To practice this preventive wisdom, we must understand the human body as a microcosm, a complete universe mirroring the macrocosm of heaven and earth. The fundamental structure of this inner universe is governed by interconnected energetic dynamics. Yin and Yang, the 5 phases, wood, fire, earth, metal, water, and the vital substances, qi, blood, and body fluids, jin yi. The 5 zong organs, heart, liver, spleen, lung, kidney, are considered yin organs, responsible for storing essence, jing, spirit, shun, and qi. The 6 fu organs, gallbladder, stomach, large intestine, small intestine, bladder, and san jiao, are considered yang organs, responsible for receiving, transforming, and transmitting food and waste. All systems must be in harmonious balance to maintain life. When the body and mind successfully align with the cosmic cycles, for instance, observing the seasonal laws of spring birth, summer growth, autumn harvest, and winter storage, we achieve what the Neijing calls a long-existing heavenly mandate. However, when external forces, such as cold, dampness, or heat, or internal forces, such as excessive joy, anger, or worry, disturb this delicate balance, illness ensues. For example, the ancients knew that cold injuring the heart and liver was a severe pathology. Your particular combination of these energetic tendencies, the relative balance or imbalance of yin and yang, qi, blood, and fluid, determines your constitutional type, Tizhi. Understanding this constitution is the first, essential step toward personalized longevity. The promise: mastery of the inner self. Over the next 2 hours, we will delve deep into the core texts that define these concepts. We will use the authoritative insights of the classics to systematically decode this inner blueprint. We promise that by the end of this narrative, you will possess the foundational knowledge to 1. Identify the defining characteristics of the primary constitutional types. 2. Understand the specific patterns of qi, blood, yin, and yang imbalance associated with each type. 3. Learn the fundamental principles of diet, lifestyle, and therapeutic strategies, rooted in the classics, required to harmonize and manage your unique health profile, thereby fulfilling the mandate of Zhi Wei Bing. Let us begin this gentle yet authoritative exploration into the heart of traditional Chinese medicine. The core foundations of TCM. We now turn our attention to the bedrock concepts upon which all subsequent diagnostics and therapeutics are built: the dynamic trio of yin and yang, the cyclical interaction of the 5 phases, and the vital flow of qi, blood, and body fluids. These fundamental theories map your unique physiological landscape, giving us the key to your inner blueprint. Yin and Yang, the great dichotomy. The universe, according to the ancient texts, is an expression of 2 perpetually oscillating, interdependent energies. Yin and Yang. Heaven is the great Yang, earth is the great Yin. This dichotomy provides the essential framework for understanding all phenomena, from the cosmos to the intricate workings of the human body. Yin and Yang in the human microcosm. Within the body, we find this duality precisely mirrored. 1. Location and direction. The exterior of the body is considered yang, while the interior is yin. The back, or dorsum, is regarded as yang, and the front, or abdomen, is yin. 2. Function and activity. Active movement, heat, and intensity are manifestations of yang. Stillness, coolness, containment, and rest are manifestations of yin. 3. Vital substances. Within the vital substances, qi, energy, is yang, governing movement, transformation, and warming. Blood, shui, is yin, responsible for nourishing, moistening, and providing physical substance. 4. Organ systems. The organs are categorized functionally. The zong organs, heart, liver, spleen, lung, kidneys, are considered yin organs, because their primary function is to store essence, jing, spirit, shun, and qi. The fu organs, gallbladder, stomach, large intestine, small intestine, bladder, and the san jiao triple burner, are considered yang organs, as they receive, digest, transform, and transmit food and waste. Yin and yang in seasonal and daily cycles. The progression of seasons and the rhythm of the day are governed by the constant shifting of yin and yang. A yearly cycle. The spring and summer months are dominated by yang qi, which is naturally abundant and growing. The autumn and winter months see the ascendance of yin qi, leading to storage and dormancy. The deepest expression of yin occurs at the winter solstice, midnight, while the deepest expression of yang occurs at the summer solstice, noon. A daily cycle. The day itself is divided into phases of yin and yang. From daybreak to noon is yang within yang. From noon to sunset is yin within yang. From sunset to the time the rooster crows, or midnight, is yin within yin. From the rooster crows to daybreak is yang within yin. This intricate system allows practitioners to understand not just what is ill, but when the imbalance is most active, influencing treatment timing, particularly regarding pulse diagnosis. The 5 phases, Wu Xing interconnected cycles. The theory of the 5 phases or 5 elements, Wu Xing, explains how the fundamental dynamics of yin and yang manifest through 5 distinct energetic qualities: wood, fire, earth, metal, and water, and how these energies cyclically interact within nature and the body. Elemental correspondences. 5 zong systems. Each phase is fundamentally linked to a major zong organ, season, color, taste, emotion, and tissue, providing a systematic map of physiological connections. 1. Wood mu. Organ, liver, gone. Season, spring. Taste, sour, swan. Tissue, tendons, gene. Emotion, anger, new. 2. Fire. Organ, heart, exien. Season, summer. Taste, bitter, ku. Tissue, blood vessels, mai. Emotion, joy, shi. 3. Earth 2. Organ, spleen, pi. The spleen and stomach are associated with the center and earth. Season, late summer, changxia. Taste, sweet, gone. Tissue, muscles/flesh, rou. Emotion, pensiveness, si. 4. Metal jin. Organ, lung, fei. Season, autumn. Taste, pungent, exine. Tissue, skin and body hair, pai mao. Emotion, grief/sadness, bei. 5. Water, shui. Organ, kidney, shen. Season, winter. Taste, salty, xian. Tissue, bones and marrow, gu sui. Emotion, fear, kong. The generating sheng and controlling ku cycles. The 5 phases are perpetually in motion, creating and regulating each other. The generating cycle, mutual production. This cycle ensures the sustenance and flow of life. Wood generates fire, fire generates earth, ashes. Earth generates metal, minerals. Metal generates water, condensation, and water generates wood. For example, the liver, wood, generates blood, fire/heart. The controlling cycle, mutual restraint. This cycle prevents any single element from becoming excessively dominant, maintaining balance. Wood controls earth, roots hold soil, fire controls metal, melting, earth controls water, dams, metal controls wood, cutting, and water controls fire. The health of the entire system depends on the uninterrupted harmony of this network. When these cycles are disturbed, either by excess, taigua, or deficiency, buji, pathological changes occur. Qi, blood, and body fluids, Jin Yi. If Yin Yang and 5 phases provide the blueprint, then Qi, blood, and body fluids, Jin Yi, are the vital substances that fill and operate that structure. The balance and flow of these three are paramount to health. Qi, vital energy. Qi is the essence of life and the fundamental source of existence. It is often described as the subtle vital energy that empowers all physiological activity. A function. Qi warms the skin and flesh. It is the origin and root of the lung, governing respiration. Qi circulates throughout the body's channels, meridians, and is responsible for movement and transformation. Categories. Qi has both clear and turbid components, qing and zhua. Clear qi ascends to the upper body and nourishes the yin-zong organs, such as the lung. Turbid qi descends to the yang-fu organs, such as the stomach and intestines, to aid in digestion and excretion. Blood is the primary material substance circulating within the vessels, mai. A function. Blood moistens, nourishes, and provides a dense material foundation for the body. It carries the spirit, shen, and essence, jing. The heart is the ruler of blood circulation. The liver is responsible for storing and regulating blood flow. In relationship to yin/yang, blood is categorized as yin because of its substantial, moistening, and quiescent nature. Body fluids, jin yi. Body fluids, or jin yi, encompass all normal liquid substances in the body, ranging from clear sweat and tears, jin, to thicker, nourishing fluids, yi. Function. Fluids are essential for lubrication, nourishing the marrow, bones, and joints, and moisturizing the skin. They are crucial for harmonizing internal functions and helping the spirit, shen, to self-generate. A formation. Fluids are generated from the essence of ingested food, gu qi, after transformation by the spleen and stomach. The interdependence of qi, blood, and fluids. These three substances are fundamentally inseparable. Qi moves blood. Qi is the engine that propels blood through the vessels. If qi stagnates, blood flow will also slow, potentially leading to stasis. A blood carries qi. Blood provides the material foundation for qi to root and function properly. Fluids are transformed by qi and enrich blood. The efficient transformation of food into jin yi depends on the qi activity of the spleen/stomach. These fluids, in turn, help constitute and maintain the quality of the blood. Qi, blood, and body fluids, jin yi. If yin yang and 5 phases provide the blueprint, then qi, blood, and body fluids, jin yi, are the vital substances that fill and operate that structure. The balance and flow of these three are paramount to health. Qi, vital energy. Qi is the essence of life and the fundamental source of existence. It is often described as the subtle vital energy that empowers all physiological activity. A function. Qi warms the skin and flesh. It is the origin and root of the lung, governing respiration. Qi circulates throughout the body's channels, meridians, and is responsible for movement and transformation. Categories. Qi has both clear and turbid components, qing and zhua. Clear qi ascends to the upper body and nourishes the yin-zong organs, such as the lung. Turbid qi descends to the yang-fu organs, such as the stomach and intestines, to aid in digestion and excretion. Blood is the primary material substance circulating within the vessels, mai. A function. Blood moistens, nourishes, and provides a dense material foundation for the body. It carries the spirit, shen, and essence, jing. The heart is the ruler of blood circulation. The liver is responsible for storing and regulating blood flow. In relationship to yin/yang, blood is categorized as yin because of its substantial, moistening, and quiescent nature. Body fluids, jin yi. Body fluids, or jin yi, encompass all normal liquid substances in the body, ranging from clear sweat and tears, Jin, to thicker, nourishing fluids, Yi. Function. Fluids are essential for lubrication, nourishing the marrow, bones, and joints, and moisturizing the skin. They are crucial for harmonizing internal functions and helping the spirit, Shen, to self-generate. A formation. Fluids are generated from the essence of ingested food, Gu Qi, after transformation by the spleen and stomach. The interdependence of Qi, blood, and fluids. These three substances are fundamentally inseparable. Qi moves blood. Qi is the engine that propels blood through the vessels. If Qi stagnates, blood flow will also slow, potentially leading to stasis. A blood carries Qi. Blood provides the material foundation for Qi to root and function properly. If fluids are transformed by Qi and enrich blood, the efficient transformation of food into Jin Yi depends on the Qi activity of the spleen/stomach. These fluids, in turn, help constitute and maintain the quality of the blood. The blueprint. Classification of the constitution. The purpose of mastering Yin-Yang, the 5 phases, and Qi blood fluid theory is to recognize the complex yet predictable patterns of internal harmony or disharmony, which define the individual constitutional blueprint, Tizhi. The concept of the body being a microcosm of the universe, with its 9 fields, Jiu-Yi, corresponding to the 5 Yin-Zang organs and 4 Yang-Fu organs, dictates that no two individuals are precisely alike. While the system operates based on cosmic laws, each person inherits a unique energetic balance. Constitutional variations are simply expressions of the relative balance of the core vital substances. An imbalance of Qi and blood. For example, a state of blood depletion, Su, combined with Qi stagnation, Yu, results in predictable symptoms like localized pain. An imbalance of Yin and Yang. An excess of Yang, Yang Sheng, leads to patterns of exterior heat or hyperactivity. Conversely, an excess of Yin, Yin Sheng, leads to internal coldness. These constitutional leanings determine how an individual responds to disease and stress. A elemental predominance. Personality, physique, and emotional tendencies are often categorized according to the 5 phases. For Impel, the wood type, the fire type, indicating where the energetic balance naturally resides. Thus, the widely recognized 9 constitutional types are not arbitrary categories. They represent distinct, identifiable long-term patterns arising directly from chronic imbalances in the production, distribution, or functioning of Qi, blood, Yin, and Yang, measured across the interconnected framework of the 5 phases. In the following sections, we will utilize this foundational knowledge to systematically examine each constitutional type, allowing you to recognize your own unique inner blueprint and the pathways toward restoring your personal balance. 1. Balanced or harmonious type. The balanced type represents the ideal state of health, marked by the smooth, uninterrupted flow of vital substances and the stability of the 5 Zang organs. First, let's examine the clinical manifestations, the signs of true health and vitality. In a state of harmony, the movement of the vital substances is orderly. Clear Qi ascends to the upper orifices and nourishes the Yin organs, while turbid Yin descends to the lower orifices for excretion. A vibrant constitution. The complexion is bright and radiant, indicative of healthy Qi and blood flow. The senses are sharp and the spirit, Shen, is serene. A physiological strength. The essence, Jing, spirit, Shen, and Qi are stored and function well within the Zang organs. Metabolism is highly efficient, and body fluids circulate smoothly without stagnation or accumulation. A sleep and appetite. Sleep is deep, appetite is good, and digestion is strong, ensuring that the acquired Qi, Gu Qi, is abundant. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. The balanced type is inherently the most resilient. They embody the principle that Yin and Yang are in equilibrium, where neither coldness, Han, nor heat, Ri, is dominant. They are less susceptible to external evils, wind, cold, dampness, because their defensive Qi, Wei Qi, is strong, flowing easily in the skin and flesh, Ku Li. Risk factors. While robust, this type must guard against conditions that disrupt the fundamental harmony, such as damp heat arising from improper diet, or the internal injury caused by excessive emotional fluctuation, like extreme joy or anger. The goal of practice. For the balance type, the goal is maintenance, to prevent the separation of blood and qi, shui qi and li, or the disruption of yin and yang harmony caused by external shocks. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. Maintaining the balanced state requires aligning oneself with the cosmic rhythms, following the seasonal laws of spring birth, summer growth, autumn harvest, and winter storage. A dietary harmony. Emphasis is placed on moderate, seasonal eating, consuming foods that harmonize the five tastes: sweet, pungent, sour, bitter, salty. A seasonal management. Striving for tranquility in winter to store essence and allowing the spirit to self-generate. Therapeutic focus. Prevention, ensuring the flow of qi and blood is never obstructed, thus avoiding stagnation, yu, or accumulation, ji. 2. Qi-Deficient type. The Qi-Deficient type is characterized by a pervasive weakness in the body's fundamental energy, often originating in the spleen/stomach, the source of acquired qi. First, let's examine the clinical manifestations, the signs of true health and vitality. Qi is yang in nature. When deficient, the body lacks warmth, movement, and defensive capability. A weakness and fatigue. Symptoms include shortness of breath, duan qi, reluctance to speak, a faint and soft voice, and a constant feeling of mental and physical exhaustion. Organ-specific deficiencies. Spleen/lung. Since the spleen generates acquired qi, weakness often manifests as poor appetite, loose stool, as the spleen fails to transform food, and vulnerability due to weak defensive qi, wei qi. Pulse and appearance. The pulse is typically weak and deficient. The complexion may be pale or sallow. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. A deficiency of qi puts the person at high risk for collapses of function, as qi is the substance that holds and lifts structures. Digestive issues. Prone to chronic diarrhea and sui xia, undigested food in stool. A susceptibility to external evils. Weak wei qi means the exterior is easily susceptible to wind and cold invasions, resulting in frequent colds or surface-level ailments. A progression to yang deficiency. Over time, if qi deficiency is not addressed, it often leads to a deficiency of yang energy. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The central therapeutic principle is to tonify the qi, bu qi, particularly strengthening the earth element, spleen/stomach. Dietary focus. Favor warm, sweet, and neutral foods. Sweet foods are often associated with the spleen/earth. Texts describe substances that reinforce the body like ginseng, ranshen, noting it maintains the 5 zong organs, calms the spirit, and helps the body resist cold and heat. A lifestyle. Avoid strenuous activity or excessive sweating, which depletes qi. A prescription focus. Formulas should reinforce the spleen and lung. 3. Yang-Deficient type. Yang deficiency is characterized by a lack of warming, moving, and activating energy in the body, resulting in internal coldness, Nei Han. First, let's examine the clinical manifestations, the signs of true health and vitality. Yang is the dynamic force. Its deficit results in systemic coolness and sluggishness. Extreme cold signs. Profound intolerance to cold, cold limbs, Cizhi, and cold pain. Patients often desire warm drinks. Functional sluggishness. Since yang qi warms and transforms water, its deficiency often leads to the accumulation of clear, cold body fluids. Pulse and spirit. The pulse is typically deep and slow, chen qi. The spirit, shen, may appear low, reflecting hypofunction. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. Yang deficiency makes the body highly vulnerable to cold and damp evils, potentially leading to the generation of pathogenic phlegm. Digestive and excretory failures. Leads to cold edema, han shui, or chronic watery diarrhea with undigested food, spleen yang deficiency. Severe cold injury to the heart/liver has been historically described as a severe pathology. A predisposition to BI syndromes. Cold and dampness easily obstruct the channels, causing chronic pain and immobility BI syndrome. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The central therapeutic principle is warming and tonifying yang, Wen Yang Bu Su, dispersing cold. A dietary focus. Strictly favor warming, pungent foods. Avoid raw vegetables, cold drinks, and cooling foods which consume yang energy. A seasonal protection. Crucial attention must be paid to protecting against cold, particularly during winter. Protection of the back and abdomen is vital. A prescription focus. Classical remedies utilize strong warming agents like prepared aconite, Fuzi, and ginger, Ganjiang, to revitalize the collapsing yang, especially for emergency conditions. 4. Yin-Deficient type. Yin deficiency is defined by an insufficient material foundation, blood, fluids, essence, relative to the functional yang, creating a relative internal heat, termed empty heat, Su-Ri. First, let's examine the clinical manifestations, the signs of true health and vitality. Since Yin represents cooling and moistening, its depletion leads to signs of internal dryness and agitation. Heat signs. Empty symptoms are characterized by low-grade heat, particularly the sensation of heat in the 5 centers, palms, soles and chest, tidal fevers and night sweats. Fluid depletion. Manifestations of dryness are prominent. Dry mouth and throat, dry skin and constipation. The tongue may appear red with little or no coat. Mind and spirit. Deficiency of kidney essence, Jing, and heart Yin can lead to mental restlessness, Fan, and insomnia. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. This constitution is vulnerable to conditions that further consume Yin or generate intense heat. Overconsumption. Excessive activity or consuming too many hot, spicy, or drying foods, which accelerate the consumption of body fluids. Wasting and consumption. Prone to Shao Ku, wasting and thirsting disease. The lack of nourishment means structures may become hard or brittle. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The primary principle is nourishing Yin and moistening dryness. Zi Yin Run Zao, stabilizing the material basis of the body. A dietary focus. Favor moistening, cool and neutral foods. Avoid hot, spicy, and roasted foods which further dry the body. A seasonal management. The Yin-deficient person must be extremely careful during dry autumn and hot summer months. They should seek calm and quiet rest to preserve essence. A prescription focus. Utilize herbs that richly replenish fluids and essence, such as those that cool heat and promote fluids. 5. Phlegm dampness type. Phlegm dampness is characterized by the accumulation of heavy, turbid, pathological substances, tan sure, arising primarily from a dysfunction of the spleen. First, let's examine the clinical manifestations, the signs of true health and vitality. Dampness and phlegm are inherently heavy, sticky, and tend to settle and obstruct. Physical features. Often presenting with a tendency toward corpulence, heavy limbs, feeling dull or sluggish, and excessive clear or turbid discharge, like copious sputum. A spleen disturbance. Poor spleen function leads to feelings of stomach fullness and a lack of appetite. The tongue may be pale with a thick, sticky coating, indicating turbidity. A obstructed flow. The obstruction of turbid matter high up can lead to chest and diaphragm fullness, xiongbai, and shortness of breath. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. This constitution is prone to internal blockages and conditions related to excess fluid accumulation. A gastrointestinal and cardiovascular risks. Damp phlegm is intimately linked to chronic digestive disorders and potential cardiovascular issues. The presence of tan, phlegm, can lead to the formation of visible lumps or internal masses. A seasonal vulnerability. Highly susceptible to external dampness, especially during the late summer, Changsha, or in damp climates. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The core strategy is to fortify the spleen, dry dampness, and transform phlegm. Jian Pai Zhao Shi Hua Tan. A dietary focus. Strictly restrict intake of cold, sweet, or oily foods, which further burden the spleen. Favor foods that dry and resolve dampness. A lifestyle. Encourage movement to aid the circulation of qi and fluids. Avoid damp living conditions. A prescription focus. Formulas must address the root, spleen deficiency, and the manifestation, dampness, phlegm. 6. Damp heat type. The damp heat type is characterized by the difficult mixture of pathogenic dampness and pathogenic heat, creating a sticky, smoldering state within the body. First, let's examine the clinical manifestations, the signs of true health and vitality. The combination of dampness and heat makes symptoms complex, heavy and persistent, dampness, yet irritating and consuming, heat. Appearance and secretions. Manifestations include an oily face, yellow-tinged secretions, urine, sweat, or discharge, and a heavy, sticky feeling in the body. The tongue coating is often thick, yellow, and greasy. A digestive and hepatic discomfort. Leads to feelings of fullness, bitter taste in the mouth, related to the gallbladder/liver, and irritability. Excretory dysfunction. Difficulty or burning sensation during urination or defecation. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. Damp heat creates an environment conducive to inflammation, infections, and chronic skin conditions. Skin conditions. Prone to abscesses, sores, and inflammatory skin disorders, as the toxic heat attempts to vent through the exterior. Chronic diseases. Persistent damp heat can lead to chronic infections and metabolic disturbances. Impact on blood and fluids. Heat consumes fluids, while dampness obstructs circulation. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The therapeutic strategy involves separating and removing both factors. Clearing heat and eliminating dampness. Qing Li Shi. A dietary focus. Strictly avoid hot, spicy, deep-fried, and highly sweet or alcoholic foods. Favor cool, drying, and bitter-tasting foods. Bitter drains heat and dries dampness. A seasonal management. The damp heat constitution suffers significantly during hot, humid weather. Prescription focus. The aim is to utilize classical herbs that can simultaneously clear heat, such as Huangqin, Chinese skullcap root, or Huanglian, Coptis rhizome, while also facilitating the outflow of dampness through ingredients like Fu Ling, Poria, or Zexia, water plantain rhizome. 7. Blood stasis type. Blood stasis is a condition where the blood flow, shuexing, is sluggish, constrained, or blocked. First, let's examine the clinical manifestations, the signs of true health and vitality. Stasis is characterized by stagnation, resulting in predictable, fixed symptoms. Pain characteristics. The hallmark is fixed, sharp, boring pain that is aggravated by pressure. This pain is distinct from moving or diffuse pain. Appearance. The complexion, lips, or tongue may appear dusky, purple, or dark. Hard and immovable masses may form. Pulse. The pulse may feel rough, choppy, or wiry, indicating obstruction. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. Blood stasis is associated with fixed obstructions in the vessels and tissues. A progression from stagnation, chronic emotional repression, qi stagnation, or prolonged exposure to cold can lead to blood stasis, as qi cannot push the blood. Reproductive issues. Stasis often impacts gynecological health, causing dysmenorrhea, painful menstruation. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The core therapeutic strategy is invigorating blood and dispersing stasis. Hua Shui Hua Yu. A dietary focus. Incorporate foods and herbs that promote circulation. Avoid excessive cold or raw foods that could cause congealing. A lifestyle. Regular moderate movement is essential to promote the circulation of qi. A prescription focus. Use specific herbs to break stasis, such as peach kernel, tao ren. The treatment must also address the underlying cause. 8. Qi stagnation type. Qi stagnation is characterized by the constrained or inhibited flow of qi throughout the body, frequently involving the liver system. First, let's examine the clinical manifestations, the signs of true health and vitality. Since qi is responsible for movement and governs emotional equilibrium, stagnation leads to constraint and mental distress. Emotional symptoms: prone to depression, anxiety, sadness, frequent sighing and irritability. Physical symptoms: vague, moving or distending pain that shifts location, unlike the fixed pain of blood stasis. Feelings of fullness and oppression, particularly in the chest and flanks, liver channel area. Sleep and digestion. Digestion may be impacted as liver qi obstructs spleen function. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. The primary risk for this constitution is the internal damage caused by chronic emotional repression or stress. A progression to heat or stasis. Prolonged qi stagnation creates heat, stagnation generates fire, leading to qi yu hua hua. Furthermore, qi is the commander of blood. Inhibited qi flow inevitably leads to blood stasis. Organ damage. The classics emphasize that excessive anger injures the liver. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The key principle is to soothe the liver and regulate qi, Shu Ganli qi. A dietary focus. Consume foods and herbs that are aromatic and mildly pungent to encourage movement and dispersion. A lifestyle and seasonal alignment. Emotional regulation is the highest priority. Gentle stretching or movement helps disperse stagnant qi. A prescription focus. Use herbs that disperse stagnation and soothe the liver. 9. Allergic diathesis type/inherited sensitivity. The allergic diathesis type describes an inherent tendency to react strongly to external stimuli, related to an innate deficiency in the defensive qi, wei qi, possibly combined with an inherited imbalance, xian tian buzu. First, let's examine the clinical manifestations, the signs of true health and vitality. This pattern is characterized by the defensive qi being weak or disorderly. External reactions. Highly susceptible to exterior wind, cold or heat. Symptoms may include chronic sneezing, frequent itching, skin rashes or sudden asthma attacks. A weakened exterior. The defensive qi fails to properly guard the skin and pores, Kuli, making the individual easily affected by seasonal or environmental changes. A underlying disharmony. The external reactions are reflections of an underlying disharmony, such as weak qi that cannot secure the exterior. Next, we look at optimal resilience and maintenance. How to protect this inherent strength. The primary risk is frequent invasion by external pathogenic factors and chronic respiratory or skin inflammation. A frequent illness. Prone to repeated episodes of common cold or wind invasion. Autoimmune and allergic tendencies. This type's hyperreactivity suggests an instability in the body's defensive response. Finally, the TCM principles for diet and seasonal alignment. Your roadmap for nourishing life. Yang Sheng. The main therapeutic principle is strengthening the defensive qi and stabilizing the surface. Gu Biao Yi Qi. A dietary focus. Avoid foods known to provoke hyperreactivity or generate wind and heat internally. Focus on tonifying the spleen and lung qi. Seasonal management. Requires meticulous protection from sudden weather changes, especially during spring, when wind is abundant and can carry external pathogens. A prescription focus. Use prescriptions aimed at stabilizing the exterior and stopping the wind, often relying on herbs that help consolidate the pores and reinforce the body's barrier. Having mapped these 9 constitutional tendencies, from the ideal harmony of the balanced type to the predictable patterns of deficiency and accumulation, we now possess the foundational language to interpret the subtle signs of imbalance. The classical texts repeatedly emphasize that, when external factors prevail, we must expel them. When deficiency prevails, we must nourish it. This forms the basis of therapeutic strategy. Whether your blueprint leans toward the chilling inertia of Yang deficiency or the restless heat of Yin deficiency, the path to longevity lies in recognizing the imbalance and restoring the flow of Qi, blood, Yin, and Yang within the five-phase system. In our next and final section, we will synthesize this knowledge, moving from recognition to practical daily guidance. Integrating TCM into modern life. We have navigated the internal terrain, mapping the 9 distinct blueprints that describe your potential for health and vulnerability to disease. The true value of this ancient knowledge lies not merely in identification, but in application, the art of bringing the wisdom of the classics into your modern daily rhythm. The overarching principle of TCM health management is nourishing life, Yang Sheng, seeking to sustain the physical form and extend the years of life. This is achieved by harmonizing the microcosm, the human body, with the macrocosm, heaven and earth. Lifestyle integration. Applying constitutional nourishment. The foundation of Yang Sheng rests upon managing the 3 critical pillars of daily life: rest, activity, and emotional harmony. Harmonizing with cycles. Sleep and rest. First, let's examine harmonizing with cycles. Sleep and rest. TCM views the daily cycle as a reflection of the transition between Yang, daytime activity, and Yin, nighttime repose. Night is the phase when Yin Qi is stored and consolidated. The texts emphasize that when heaven is the great Yang and earth is the great Yin, one must adjust their lifestyle accordingly. As the sun descends, activity Yang should give way to stillness Yin. Proper rest allows the spirit Shen to settle and fluids to be transformed and contained. The Neijing teaches that the spirit needs to settle to allow for self-generation and replenishment. Lack of quietude and rest during the Yin hours dissipates essence and leads to a separation of Qi and blood, Shui Qi Fen Li. Constitutional guidance. The Yin-Deficient type must prioritize sleep to prevent the consumption of their scarce fluids and essence by empty heat. Insomnia and mental restlessness, Fan, are common symptoms of Yin depletion, demanding tranquility. The Qi stagnation type may suffer from restless sleep due to agitated Qi. They require relaxation techniques before bed to promote the smooth flow of Qi, helping the agitated Qi to settle. B. Movement and transformation. Physical activity. Next, we look at movement and transformation. Physical activity. Activity, corresponding to Yang, is necessary to promote the vital flow of Qi, blood, and fluids. Movement is essential for the circulation of Qi and blood. If Qi stagnates, blood stasis may follow, as Qi is the commander of blood. Constitutional guidance. The phlegm dampness type greatly benefits from activity, as movement aids the spleen's function of transforming fluids and prevents the heavy accumulation of turbidity. However, the intensity must be moderated to avoid overexertion. The Qi-Deficient type must approach exercise cautiously. Since they suffer from lack of vital energy and easy depletion, excessive sweating or strenuous activity consumes their already deficient Qi. Their focus should be on gentle, sustained movements that support the spleen and stomach function. C. Cultivating stillness. Emotional balance. Finally, the TCM principles for cultivating stillness. Emotional balance. The classics rigorously link emotions to the zong organs, treating emotional discord as a direct path to internal illness. Excessive or chronic emotions disrupt the flow of Qi and injure the zong organs. For instance, intense or repressed anger injures the liver, wood element, leading to liver Qi stagnation or fire. Excessive joy or overthinking injures the heart and spleen, respectively. Constitutional guidance. The Qi stagnation type is intrinsically linked to emotional constraint. Their therapeutic goal must be soothing the liver and regulating Qi, Shu Ganli Qi. This requires avoiding chronic repression and actively cultivating emotional equilibrium. The Yang-Deficient type, prone to cold and slowness, should avoid dwelling on sadness or pensiveness, c. which can consume spleen yang and exacerbate dampness. Instead, mild, nourishing joy can aid the heart yang. The danger of generic advice. Emphasizing personalization. TCM's effectiveness rests entirely on Bianjing Shiji, the determination of the treatment based on the differentiated pattern. It is critical to recognize that generalized health trends, often popular in the modern world, carry specific dangers when applied indiscriminately, ignoring the person's unique constitutional blueprint. The greatest warning from the classics is against blindly applying treatments suited for one pathology to a different constitutional pattern. For instance, texts like the Shanghan Zabing Luan repeatedly emphasize that one must never administer a method that conflicts with the underlying deficiency or excess of the patient. The peril of purging and elimination. Extreme diets/detoxes. Many modern trends focus on aggressive cleansing or caloric restriction, fasting/extreme diets, which mirrors the TCM principles of purgation, gongxia, or inducing vomiting, yang-2. These methods are reserved for clear states of excess, like accumulated damp heat or severe internal cold accumulation. Danger to deficiency. If a Qi-Deficient or blood-deficient person attempts radical cleansing or aggressive dieting, they will deplete their already insufficient reserves of Qi, blood, and essence, risking collapse. For instance, the classics warn against inducing sweat, Fa Han, in those who are already deficient or weak, as forcing fluid out can lead to failure of recovery. Misapplication of cold. Following a cooling diet, e.g., excessive raw vegetables or smoothies, may be suitable for the Yin-Deficient type to clear empty heat. However, if practiced by the Yang-Deficient type, this will dramatically exacerbate the internal cold, leading to further fluid stagnation and serious functional impairment. The need for constitutional consistency. True longevity, according to the venerable tradition, is achieved through gradual, consistent support tailored to the individual constitution. For example, substances renowned in the Shenong Benqiao Jing such as ginseng, Ren Shen, which maintains the 5 zong organs, calms the spirit, and helps the body resist cold and heat, are meant to reinforce the foundation of the Qi-Deficient or the balance types. However, such tonifying agents would be inappropriate for someone suffering from acute excess, like intense damp heat. The ultimate message of the classics is empowerment through knowledge. You are not merely a collection of symptoms, but a complex, interconnected system governed by the dynamic interplay of yin, yang, qi, and blood. Your constitutional blueprint is the map. By following the precise, personalized instructions inherent in your type, you move away from generalized solutions and step onto the ancient path of true, deliberate, nourishing life. Conclusion and next steps. We conclude our profound immersion into the fundamentals of classical Chinese medicine. You have now established the initial boundaries of your inner blueprint. This is not merely academic knowledge. This is the core wisdom required to master your own longevity. Recap. The imperative of knowing your blueprint. We started by acknowledging that the highest art of medicine is to treat the disease before it manifests. Zhi Wei Bing. We have seen how all physiological processes, from the movement of the seasons to the thoughts of the mind, are governed by the universal dynamics of yin and yang, the 5 phases, and the vital flow of qi, blood, and fluids. Your constitutional type, be it the fiery agitation of yin deficiency, the chilling inertia of yang deficiency, or the constrained emotion of qi stagnation, is simply a predictable pattern resulting from the chronic imbalance of these foundational substances. By understanding your blueprint, you know precisely where your vulnerabilities lie. The essence of the classical therapeutic strategy becomes clear. When deficiency prevails, we must nourish it. When excess prevails, we must expel it. This approach moves you beyond generic health mandates and puts you directly on the path of personalized well-being, focusing on restoring the harmony of your zong organs, which store essence, spirit, and qi, rather than simply suppressing superficial symptoms. Cultivating harmony. The ancient mandate. The wisdom held within the ancient texts is a constant invitation to return to internal stillness and external alignment. The aim of Yang Sheng, nourishing life, is to harmonize your inner climate so that your life's essence, Jing, remains robust, your spirit, Shen, is serene, and your qi flows unimpeded. To follow the path to true longevity means to apply the insights of your constitutional type consistently in your diet, your rest, and your emotional world, so that you may achieve long-existing heavenly mandate. Chongyu Tianming. Remember, the body is a microcosm reflecting the universe. The ability to recognize your current state is the first and most critical step toward recovery and prevention. Cherish this knowledge, treat it with reverence, and apply it with gentleness and discipline. Next steps. Deepening the practice. This journey into the inner blueprint has only just begun. Many common modern afflictions are direct manifestations of the constitutional imbalances we have explored today, particularly disturbances rooted in the heart and liver systems. In our next lecture, TCM Secrets to Healing Insomnia and Anxiety, a body-type approach, we will take the knowledge of Yin deficiency and Qi stagnation and apply it specifically to calming the spirit, Shen, and resolving restlessness, Fan. Conditions often linked to the heart, the seat of consciousness, and the liver's role in the flow of Qi. If you found value in this authoritative and calming exploration, please consider subscribing to our channel and sharing this wisdom. This ensures you will continue to receive guidance on the profound and personalized path of traditional Chinese medicine. Thank you for joining us on this essential journey towards self-mastery and lasting health.